As you know, the inflation numbers just came out, and we have very low inflation, so that would give Too-Late Powell the chance to give us a nice, beautiful, big rate cut, which would be great for the country, but rates are falling also, and growth is going up. We have tremendous growth numbers, so growth is going up. So I'll be talking about that today in Detroit. It's a big speech, and I can only say that the country's doing well. You saw my statement on Iran. You saw my statement on Minnesota. On Minnesota, we have taken out killers, rapists, drug dealers, people from mental institutions that came in illegally. All of them, most of them came in illegally. They're from other countries. They came in under the Biden ridiculous open border policy, and we've gotten a lot of them out. We just had numbers from Chicago, where Chicago crime has gone down pretty good. It could go down 100% virtually, but we're fighting with that governor who's so incompetent. But as you know, we took out a lot of killers, murderers, drug dealers, drug addicts, mental institution people, and people from jails. We took them out of Chicago. So Chicago's got much better numbers now than it had a few months ago. We will get no credit for it, but these are minor details. Crime in Washington, D.C. is almost non-existent. It's a safe place, so people can come bring their families. They can send their son and daughter to look at Lincoln, Washington, Jefferson, or whatever they want to look at. But it's almost non-existent. We're very proud of that. In the coming weeks, I will be laying out even more plans to help bring back affordability. And again, remember, that's a fake word by Democrats. Prices were too high. They caused the high price. They never want to talk about affordability. They always go, this is an election about affordability. I say, they caused it. But they're good at that stuff. They're good at that stuff. They're fake, and they're good at that stuff. It's an election about high prices that was caused by the Democrats and that I brought down a lot. And remember, when you see energy coming down like I brought it down, and gasoline coming down, that brings everything else down. It's so much bigger than any other factor. When gasoline gets to be $1.99 a gallon, everything comes down. The donuts come down, the truck that delivers the donuts, the stove that makes the donuts, the whole thing, it all comes down. And it's coming down much faster than anybody can even believe. And remember, though, I always say, because normally when that goes down, the world comes down. That's the bad way of bringing it down. Our growth is through the roof. So I always want to say that whenever I say prices are coming down, but our growth is going way up. Two beautiful events, the exact opposite of
the Biden administration. As part of those efforts at Davos next week, I'm going to provide much more detail about our housing policies so that every American who wants to own a home will be able to afford one. We have some great things happening with housing, as you know. You saw the $200 billion buy-in on bonds and mortgages. This will include a ban on large institutional investors buying up single-family homes all over the country and making it impossible for people to buy a home. And I've also announced that the U.S. government is purchasing $200 billion of mortgage bonds to bring down mortgage rates, and it's had a huge impact. It's already started. And just last week, the average 30-year mortgage dropped below 6% for the first time in many years. It's coming down very rapidly, and that's not with the help of the Fed. If I had the help of the Fed, it would be easier. But that jerk will be gone soon. So one of our top priorities in this mission is promoting greater affordability. Now, that's a word used by the Democrats. They're the ones that cause the problem. The one thing, they stick together. They don't have some of the people that we have. I don't know. It's a genetic thing. It's something in the blood. We got some real losers. Mostly great. But I wouldn't use the name Romney because I'm in his sort of territory. So I would never use that name. But all right, I'll use it. They don't have a Mitt Romney that votes against everything. They don't have a Rand Paul that votes against everything. I got him elected twice. He was a stone-cold loser. I went to Kentucky where I won by a lot. I did a rally for him. Then I did another rally. He won. Then I went the second time. He won. Then he votes against all the time. It's just crazy. I don't get it. Then you have Lisa Murkowski and you have Susan Collins. Disasters. And you had a gentleman from Indiana that I don't believe it, Todd Young, he voted against. And you'd say, why are you voting against? They can't give you an answer. They're unable to give you an answer. It's like, why are they against the attack on Venezuela? They're against the attack after they found out it was the most successful attack, probably the most talented, most brilliant tactically attack that we've had maybe in 100 years. And they're against it. Why? It's one thing if the attack failed. I'd probably do that too. A change. I'd be in favor. Then if it failed, I'd say, I told them not to do it. That's what they do. But here we have one of the most successful attacks ever. And they find a way to be against it. It's pretty amazing. So today I'm delighted to sign the Whole Milk for Healthy Kids Act into law, which is a very important thing for our farmers. And I think maybe more important for our people, the people that drink milk. This is the first bill signing of the new year, and it will ensure that millions of school-aged children have access to high-quality milk as we make America healthy again. I want to thank Secretary of Agriculture Brooke Rollins, who's behind me, Secretary of Health and Human Services Robert F. Kennedy Jr., Senators John Boozman and Mike Crapo, Roger Marshall, Peter Welch, as well as Representative G.T. Thompson and Tim Walberg, all great people. Also with us today is USDA National Nutrition Advisor Dr. Ben Carson, my friend for a long time. We went head-to-head, and it was not easy going head-to-head with Ben. He still looks good. That's because he drinks a lot of milk. And some of our nation's wonderful dairy farmers and their children. They're going to be farmers for a long time, we hope. As it currently stands, schools participating in the National School Lunch Program are only able to offer students low or non-fat milk options. That was changed during the Obama administration. A lot of people disagreed with it at the time. With this legislation, schools will finally be able to expand their offerings to include nutritious whole milk. It's actually a legal definition, whole milk. And it's whole with a W for those of you that have a problem. Most of the media will get that. This is the perfect follow-up to the new real food pyramid, and Secretary Kennedy and Secretary Rollins announced that last week. You probably heard. This legislation also allows parents to directly request a substitute for milk for children with dairy intolerance. Previously, parents were required to submit a written statement from a doctor, but we're eliminating that rather ridiculous policy, allowing parents to choose what is best for their child, which is a big move. Hard to believe that that would be a big thing, but it is. And of course, these changes will be major victories for the American dairy farmers, who we love and who voted for me in great numbers, I will say. I think I got every one of them. In December, I also signed the Secure Rural Schools Reauthorization Act. And I'm proud to say that these two pieces of legislation will give school-age children across the country the resources and support that they need, not just to succeed, but really to thrive in life and later on in life. Should I sign it?
Yes, sir.
Your last chance. We could go another 15 years. Right? Let's do it. Do it?
You go stand right there.
Come on, right up here.
Jesse.
We have to do a good one here. This is right?
Yes, sir.
This is an important one for me. Okay, not bad. Not bad. It's signed by auto pen. So you can never make a mistake. They made a lot of mistakes. Anyway, here it is. Thank you. Thank you all very much. Yeah.
Thank you.
Thank you. I'm going to start drinking a lot of milk.
We appreciate it.
Okay, thank you very much. That's great. Here, hold that on for a little while. You'll give it to us later, okay? It was a good job you did. Today, I'm thrilled to announce my plan to lower healthcare prices for all Americans and truly make healthcare affordable again. We're doing things that nobody's ever been able to do. We're calling it the Great Healthcare Plan. Instead of putting the needs of big corporations and special interests first, our plan finally puts you first and puts more money in your pocket. The government is going to pay the money directly to you. It goes to you, and then you take the money and buy your own health care. Nobody's ever heard of that before, and that's the way it is. The big insurance companies lose, and the people of our country win. This proposal locks in the massive discounts on prescription drugs that my administration is achieving through our most favored nation drug pricing agreement. Now, when you hear about that, for 40 years they've been trying to do it, but they never were able to do it. No other president was able to do it. I got every other country to approve it by the use of tariffs and other things. They all approved it. Nobody else got it. No other president got it. And for the most part, they didn't even try because they felt it was impossible. It'll bring down drug prices 80, 90%, in some cases, just numbers that nobody's ever heard of before. Your prescription drugs will come way, way down. And under this policy, the prices of many drugs will be slashed by 300, 400, and even 500% starting this month at the TrumpRx.gov. So instead of Americans paying the highest drug prices in the world, which we have for decades, we will now be paying the lowest cost paid by any other nation. So any other nation that's paying the lowest cost, that's what we're going to pay. And the American people will get the savings. So I have to reiterate, the lowest price in the world is what you're going to pay. Before, you were paying the highest price in the world by far, and the politicians did nothing about it. So I'm asking Congress to complete the work that we've started. Next, my plan would reduce your insurance premiums by stopping government payoffs to big insurance companies and sending that money directly to the people. Obamacare was designed to make insurance companies rich. I call it the Unaffordable Care Act, with billions of dollars in taxpayer subsidies that helped their stock prices skyrocket over 1,700%. As you paid more money for health care every single year, more and more. The premiums went higher and higher. I want to end this flagrant scam and put extra money straight into the health care savings account in your name, and you go out and buy your own health care, and you'll make a great deal. You get better health care for less money. That way you can choose the care that is right for your family. To further reduce insurance premiums, my plan ends the giant kickbacks to insurance brokers and corporate middlemen that only drive up the costs, and that's what they're intended to, drive up the cost. But we're driving down the cost. and it fully funds a long-neglected part of the law known as the Cost-Sharing Reduction Program. This measure alone should cut premiums on the most popular Obamacare plans. It's hard to believe there are any because it's a hated program. It's unaffordable, but it's going to cut them by an average of 10 to 15%. Next, the Great Healthcare Plan. That's the name. It's called the Great Healthcare because it's great healthcare at a lower price. Mandates unprecedented accountability and transparency from insurance companies and all healthcare providers so that special interests can no longer profiteer at your expense. As the saying goes, sunlight is the best disinfectant. That is why my plan orders all insurance companies to publish rate and coverage comparisons in very plain English. It requires insurers to publish detailed information about how much of your money they're going to be paying out in claims versus how much they're taking in profits. In other words, you will be able to watch the scam. It forces them to release detailed data on how many claims are being denied and whether those denials are eventually overturned on appeal. And most importantly, it will require any hospital or insurer who accepts Medicare or Medicaid to prominently post all prices at their place of business so that you are never surprised and you can easily shop for a better deal or better care. And you're going to end up doing both. You're going to get a better deal and better care. We will have maximum price transparency and costs will come down incredibly. I'm calling on Congress to pass this framework into law without delay. Have to do it right now so that we can get immediate relief to the American people, the people I love. Thank you very much. What a team. What a great job. What a great job. Please sit down. I've spent a little time doing this because I watched some of those games and these guys know how to win. Just like we knew how to win last week. We had a little victory. It was surgical, just like their victory, right, Duffy? It's an honor to welcome to the White House the two-time defending Stanley Cup champions, the Florida Panthers. Unbelievable team, unbelievable athletes, players. These men are responsible for the greatest feats in Panthers franchise history. And beyond that, you compare them to some of the greatest hockey teams ever, including the first ever President's Trophy, 3 straight final appearances, and the one that you didn't make. What the hell happened to you? You should have won that game. But it was good to do the little comeback, right? Comebacks are wonderful, actually. But the 3 was pretty good, right, Gary? And an incredible 2 straight Stanley Cup victories. And I just want to congratulate the unbelievable players. They have something different because I watched some of the games that it looked like it was going to be tough, and you pulled them out. Good for slashing. As part of the great big beautiful bill, we're increased and we have increased funding for the health care by an unprecedented $50 billion. That's rural health care. Nobody thought that was going to happen, and we got it done. So we have rural health care for those that were trying to make a case that we weren't taking care of the rural community. I'm all about the rural community. We won the rural communities by numbers that nobody's ever won them before, and we're taking care of those great people. So we already did this. We increased funding for rural health care by an unprecedented, record-setting $50 billion over 5 years, which will benefit Americans in all 50 states. And this made possible and was made possible by cutting massive waste, fraud, and abuse from Medicaid and reinvesting those funds to revitalize hospitals in our cherished rural communities and hospitals in rural communities. Rural hospitals in communities were devastated by soaring costs, and that continues. Despite colossal increases in government spending since Obamacare was passed, only 7% of the annual Medicaid spending on rural hospitals has gone to rural hospitals. So there's only a very little. They didn't care. Obama didn't care about the rural community, to be totally blunt. What he did care about is insurance companies. And this was a bill to make insurance companies wealthy. And they did. They made insurance companies very wealthy. I would say they don't like me too much because they spent hundreds of billions of dollars, and we're going to have that money spent to the people and given to the people, not we're going to circumvent the insurance companies. Partially as a result, rural health care facilities have suffered from low occupancy rates, workforce shortages, and failing programs that put Band-Aids, literally put Band-Aids over the problems in those communities. And we're not going to have that. We're taking great care of them. With the Rural Health Transformation Program, we are getting rural communities the health support they need, and we're getting it immediately. These funds will go to empowering rural hospitals, strengthening their workforce, modernizing facilities and technology, and ensuring that rural Americans get world-class health care in their own community, right smack in their own community, like they've never had it before. And they've been hurt very badly by the Unaffordable Care Act.